In the past year, ibrutinib has been FDA approved for the treatment of steroid-refractory chronic graft-versus-host disease. This is the only drug that's FDA approved for the therapy of this disease. There is an ongoing upfront randomized controlled trial that's comparing steroids plus ibrutinib to steroids plus a placebo. It's a 200-plus patient international study, and those results are, of course, not available yet. There are maintenance studies that are also being designed and now accrued. Other promising agents in the treatment of chronic GVHD now have a competitor, a baseline for which they should be compared, and I think this is opening up the clinical trial and drug development arena for this orphan disease of chronic GVHD, which greatly hurts our patients who had to go through allotransplant to cure their malignancy, but ended up with this chronic, debilitating kind of autoimmune type disease that impacts their lives for years to come. Ibrutinib is now the benchmark against which these new drugs will be compared. Understanding the mechanism through which ibrutinib is benefiting the chronic GVHD patients is the goal of our work here at the ASH this year, and that interrogation is looking predominantly through the binding of the molecule to not only the BTK, B cell signal transduction pathway, but also the T cell pathway, and we're finding some really exciting and surprising results that there is a immune modulation that benefits the anti-tumor, the antiviral, while again skewing away those pathogenic chronic GVHD disease effects. So I think we're learning a lot. There's a lot of work to do. The potential for ibrutinib to be expanded use as an immune modulator into non-chronic GVHD and maybe anti-tumor therapies like CAR therapy is a possibility.